Thank you, everyone, for joining us today. I am Tracy Marciniak. I'm the president of the Miller-Dwan Foundation, and I am delighted to be here with you today to learn more about the topic of advanced care planning, or as we sometimes call it, ACP. Before I introduce our speaker, I want to cover just a couple of quick items. We're going to keep everyone on mute for the majority of the session. There will be time for questions at the end. And feel free to post your questions in the chat during the presentation if you'd like. And then, after Wanda is finished, you can actually pop up verbally and ask as well. So a little bit about the Miller-Dwan Foundation. We are an independent 501c3 public charity, and our goal is to improve the healthcare of the people in our region so that we're excited to offer these types of educational webinars. We are the owners and creators of Solvay Hospice House, Amber Wing Center for Youth and Family Wellbeing, as well as the Charitable Foundation for Polinsky Medical Rehabilitation Center and Miller-Dwan, former name Miller-Dwan Medical Center, now Essentia Health. We take pride in creating these new care opportunities for people throughout their lifespan, and we're also proud of providing community with support and education through venues like these webinars and in non-COVID times, in-person sort of presentations with some really great speakers. So today's really great speaker is Wanda Paulson. Wanda Paulson, BA and RN, is the Advanced Care Planning Program Manager for Essentia Health. Throughout her 25 years with Essentia Health, she has become passionate about person-centered care, the importance of advanced care planning conversations, and making wishes known before crisis occurs. So again, thank you for being with us. Thank you, Wanda, for joining us and sharing your expertise. Go ahead and take it away.
Thank you so much, Tracy, and everyone in the Miller-Dwan Foundation for this wonderful opportunity to share today. I'm just going to make sure, first of all, that everybody's able to see my screen. If you want to just give me a heads up, if you're able to see it, okay?
I can see it just fine.
Okay, perfect. I will be providing my contact information. So if you are interested in getting the slides or any of the other resources that I refer to, or a directive if you're unable to print one off or those kinds of things, I'd be more than happy to do that. And as Tracy mentioned, we'll answer questions, but some people might not feel comfortable asking specific questions in a group like this. So you can feel free to reach out to me if you have more personal kind of questions. I'd be more than happy to talk to you at the end or in the days to come. So again, just thank you. And as Tracy mentioned, I've been with Essentia Health here for about 25 years and going on 26 actually. And in that time, I've worked in a number of capacities as a nurse in cardiology, in the surgical intensive care unit, in the cardiac unit in the hospital here at St. Mary's. And I worked as a nurse clinician in the heart failure program. So through all my experiences with patient care, I really became passionate about the importance of having conversations about what matters most to patients and making sure we're aligning the care that a patient would want with what matters most to them. So that is where I kind of got my start in advanced care planning and why I became so passionate about it. So this is really about person-centered care and making care that's individualized. So to that point, there might be things that come up that you might want to follow up on. So if you don't already, I encourage you to grab a pen and paper because throughout our discussion, things might come up that you want to follow up on and you might need to talk to a healthcare team or loved ones about. So I encourage you to take notes. If you have a healthcare directive that you've already completed, you can, if you happen to have a copy of that, you can refer to as we go through, would be great. If you have blank copies at home of documents that you've been given but just haven't filled out yet, that would be great as well. But if you don't have any of that, we'll get you those resources as we go. So some people that are tuning in today might have some health concerns of their own and are just interested in planning ahead. Some people that tune in to or attend classes like this are are caregivers and they have loved ones that they want to learn more about advanced care planning and having these conversations with someone that they might be in a position to make decisions for. So I've also worked with a lot of healthcare workers that they've been on the other side of things and now they're realizing how important advanced care planning is for themselves. So whatever your reason, I just want to thank you for taking time out of your day for this very important conversation. So our information for today's presentation comes from our partnership with Honoring Choices Minnesota, which I'll be referring to, as well as Respecting Choices. So COVID, the fear and uncertainty that came with COVID-19 is understandable. And over the past year and a half, we were called upon to support each other in a lot of new and different ways in many areas of our lives. And because of this illness and many of the ongoing news reports, more and more people started to really think about the kind of care they would want if they were to become seriously ill. Individuals and families who are at highest risk for complications from this particular illness started to feel especially vulnerable, but many people have felt some uncertainty or maybe even some fear in regards to their health because of this illness, or started to think about how other unexpected illnesses may come along. So although no one can eliminate the uncertainty about how sick they will get or if they'll get sick or how sick they'll become, by joining us today and having this proactive kind of conversation, our hope is to help limit some of that uncertainty. This proactive planning also is a gift to your loved ones and the clinical teams who can confidently create a plan that aligns with what matters most to you. So in our time today, we're going to talk about, define and discuss the term advanced care planning, or as Tracy said, ACP. We'll give you some time to reflect on your own experiences, values, and beliefs, help you in selecting a healthcare agent, help you consider what some possible future healthcare decisions may be, and then we'll talk about how you can transfer those wishes into a plan called an advanced directive, and then we'll suggest some ways that you can share that plan. So I just want to start with a couple questions, and I know you're on mute, so this is somewhat rhetorical, but when I meet with groups of people, I usually start by kind of gauging where people are at with their understanding of advanced care planning. So as we go, since we're not able to kind of have the in-person kind of experience, I'll share some of the things I typically hear from people. So when I ask what your understanding is of advanced care planning, some people will see things like, I'm just trying to plan ahead, or I'm getting things in order, or I'm planning for the future, or I want to make decisions about what I want if I get really sick. And so all of these are very true statements, and we're going to spend some time exploring a little bit more about what advanced care planning involves. But for some people, one of the biggest barriers to completing advanced care planning or filling out that advanced directive might be some underlying fear that comes with advanced care planning. So before we go on, I just want to take a pause and allow you to think about if you have any fears or concerns that may have prevented you from completing a directive in the past. When I've met with people, some have expressed that one of the barriers has been just not understanding some of the medical choices, or that it feels so final to put things on paper, or not quite sure what decisions to make, or some concerns that they might make the wrong choice, or what if I change my mind, or those kinds of concerns that might come up. So we're going to take some time to talk through several of these things, and hopefully you'll feel more confident by the time we're done today. So advanced care planning is for everybody, for all adults, everyone over the age of 18. It's not just for those individuals that we are concerned that they're at high risk for something to happen to. I always like to quote my grandma. My grandma used to always say, you just never know what a day is going to bring. And we know that is really true. None of us know what a day can bring. And so advanced care planning is in the process of planning ahead for those unexpected events, or for the time when we might not be able to make decisions for ourselves. But it's not a one-time event. It's important to understand that advanced care planning is a process over time. Our wishes may change as our circumstances change. And if those wishes are not expressed, decisions are made for us, and those decisions may not align with our choices or values. And then families or healthcare teams are left wondering if they made the right decision, if they're doing the right thing with what you would want. And this can really cause a lot of family stress and burden. So taking the time to be proactive is a gift to you, so you know what's important to you can be honored, but also it's a gift to those around you who would be involved with those kinds of decisions, to know that they're just doing their best to honor what you want. So a lot of things that go into advanced care planning, it's not just starting to check some boxes on the form. Many things can impact the way we make decisions. Our life experiences can really shape us. So as we start to think about our own goals for care, it's also important to reflect on those experiences that you have had. Especially, I want to take a minute and have you think about any experiences you have had with someone you know who had a sudden illness or injury and was unable to communicate. So many of us have know, or have heard of somebody who was in a situation where they could not make decisions for themselves and others had to make decisions for them. So normally when I meet with people, I really love hearing people's stories and what has really impacted them and it changed their outlook on how they make decisions. But since we're not able to do that, I want you just to reflect yourself on what experiences you have had with someone who was very sick, maybe in a car accident, had a serious illness, and was not able to make decisions or had to be cared for at a higher level. So think about your own story and your own personal experiences. And then when you have a story like that in mind, I want you to think about, what did you learn through that experience? So as you came alongside of someone who was in a serious illness, or maybe help provide care for somebody who was in a serious illness, or maybe it was someone close to you who was very ill or dying. As you look back on that experience, what did you learn as you went through that experience? So some people I've met with have expressed experiences like this that have impacted them deeply. And they've really started to think about the kind of care they would want or maybe wouldn't want if they were seriously ill. So as you think about your own experiences and what you learned as you went through those experiences, what thoughts have you had about the kind of care you would want or wouldn't want if you were in that position? So some people don't have a lot of personal experience with loved ones or family or friends that have been through this. So even to just start thinking about, when almost 2 years ago, when we started to see news reports or people that were very ill with the coronavirus, as you saw those kind of news reports and saw people that were very seriously ill, if you thought, what would I want if I was in that situation, if I was seriously ill or injured? In addition to our past experiences, it's also helpful to think about the activities that we engage in that are important to us and give our lives meaning. So to help us think along those lines, I'm just going to ask this question. If you were having a good day, what would happen on that day? Who would you talk to? What would you do? What kind of things make life most worth living to you? So, or another way I like to look at it is, what brings you joy? What kind of things bring you joy? If you wake up and you're like, today is going to be a great day, what would that day look like for you? So the things that give life meaning are very individualized and they can change over time. For example, I met with a 28-year-old who loved training for a triathlon, and he could not imagine life with a serious illness where he might lose his independence or have to have things done for him. I've heard from people in their 60s who have shared examples of the things that bring them joy are just simple things like enjoying walking the dog or being an active swimmer or being involved with their church family. I've heard from people in their 90s who gave examples of just loving to remain independent and what goes along with that, being able to have lunch with their friends. But it might be simple things like watching a pileated woodpecker in the bird feeder was one thing that someone said they just really enjoyed that day. Or getting a call from their grandchildren to tell them about a success they had. So there's a lot of differences among people. One person may say life is only worth living if I can get outside and fish and play golf or putts in the garage and do the things that I love. So being outside, being mobile, communicating, interacting with loved ones. Someone else's greatest joy might be listening to classical music or being able to read, but they might not be able to walk or care for themselves, but they found ways to adapt and find joy in each day. So what's acceptable to one person might not be acceptable to another. So as you think about what a good day looks like for you, think about what is important for you to live well, what brings meaning to your life and makes life most worth living. But as we think of those things, we can also shift our thinking to start thinking about what our overall goals for care would be if we became seriously ill. And I'm going to explore that a little bit more in the next few slides. So in the time that we have today, there's three main decisions I want you to be able to think about. The first one is who would make medical decisions for you if you were unable to speak for yourself. Secondly, to identify if there are any values or beliefs, whether they be personal, cultural, or spiritual, that may guide you and help you or may impact your treatment decisions. And then third, talking about what your goals for treatment would be if you did become seriously ill. So getting back to the first one, choosing a healthcare decision maker. One of the most important decisions we encourage all adults to make is choosing someone now who could make decisions for you if you were ill or injured and unable to make decisions for yourself or communicate your wishes. So this person would only make decisions for you if you had a sudden event and couldn't make your own decisions. And you'll want to think of an alternate or two as well. So let's say you have someone in mind. The first thing you'll want to do is to make sure that they're willing. While family or spouse may seem like a natural choice, it's important to talk to them about this role. Some people actually choose not to have family as their agents. So it doesn't have to necessarily be an automatic hierarchy that it has to first be a spouse or a child or an adult child or a sibling. It's really who would you want to make the medical decisions for you if you were unable to speak for yourself. Secondly, you're going to want to ask them if they're willing to talk with you about your goals, values, and preferences. And whoever you choose, you're going to want to communicate with them. At the first slide, it said it's all about the conversation. It's so important to have a conversation with them so they know what your current wishes are, and then have that ongoing conversation with them as you change your mind or as any of your wishes change, as your life circumstances change. Third, you're going to want to make sure that you choose someone that can agree to honor your wishes, even if they are different from their own. So they need to understand that they are speaking for you, not for themselves. And I like to use myself and my husband as an example here, just to kind of help you put this in a frame of mind. I'm a nurse and I've seen and done a lot of things. And so I know a lot of things that could be done in certain situations. My husband, on the other hand, has a huge aversion to anything medical related. And he has made it very clear to me if he had some kind of a serious illness. In his words, he said, just kick some dirt over me. He has made it very clear he does not want aggressive measures if he had a serious illness. And so my job as his healthcare agent is not to push him and say, well, we should do this, or I think we ought to do that. My job is to listen to what matters most to him and honor those wishes and be his advocate. So it's not to say that you have to choose someone who can agree and say, yes, that's exactly what I think too. That's exactly what you should do. But someone who can say, if that's what you want, I can honor those decisions and I can be your advocate. So someone that's willing to take on that role and be your advocate and speak to what's important to you if a serious situation came up. And then the last thing is to choose someone who can make decisions in difficult moments. So obviously, if you are in a situation where you're so ill you can't make your own decisions, it's going to be stressful for the people around you that love you most. But by being proactive and having this conversation, by having an advance directive in order so that they know your wishes and they are informed and can be confident that they're just following your plan, it's going to take a lot of that stress off of them. But some people are still not a good fit for this role. I've met with people where there was a situation where the husband chose not to have his wife as his healthcare healthcare agent because she just has some anxiety, and she said, I just get so worked up. She just knew she would not be a good fit. So just thinking through who would be someone who could be a mediator between the healthcare team and the rest of your family, and someone who can make those kind of difficult decisions in the difficult moments. So the next thing, in regards to any cultural, religious, or spiritual or personal beliefs, each person I have met with has a story, and we all have a story. And for care to be individualized, it really means thinking about your story and what matters most to you. And thinking that we're not just talking about the medical choices, we're talking about you as a whole person. So I want you to think about who or what helps you when you face serious challenges in life. When you've gone through those hard times, who or what helps you when you go through those hard times? When I meet people and ask this question, I have heard from people who have been through some very hard times, and they've just said things like, I just had to learn to be a strong person. Some people use this conversation to really acknowledge their family or friends or those they are close to, and they've come to just really lean into during those hard times. I've also heard some beautiful stories from patients about their faith and spirituality, the importance of prayer in their life or their faith community, how their church family has come alongside them as they've gone through those hard times. So as you think on these things, to think about if you have some cultural, religious, spiritual, or personal beliefs that might help you choose the care you want or don't want. And also think about if there are any of these beliefs or traditions that are important for you to discuss or clarify with your healthcare agent and others. For some people, during hard times like the COVID-19 crisis, we started to really think about our own mortality. And for some people, this is the first time they started to wrestle with the fact that it's not if I die, but when I die. And the advanced care planning for some people might be the first time they start to think about some end of life kind of decisions. And sometimes some of these faith and spiritual things can really almost be I don't want to say a barrier, but for some people it's well, what happens after I die, and those kinds of questions. So if you have those kinds of questions to think about, who could I talk to about any beliefs or concerns that I have? But also, the reason I want you to think on these things is, how can we as a healthcare team best support what matters most to you at your core? Some people I've met with say this just kind of thing doesn't resonate with me at all. You know, I don't go to church, I'm not spiritual, I don't pray, that's not my thing. But to still think about, what does comfort look like to you? If you were in a situation where you couldn't speak for yourself, what would comfort look like to you? So that hits home with most people too, to think about, you know, if I couldn't speak, boy, I love this particular kind of music, or I do not like to have a lot of people. I would not want to have 20 of my family members around. I would want it quiet. You know, what does comfort look like to you? And how can we best support that? So one of the things that came up to me that hit home was one patient in particular when I asked this question about spirituality, and he actually was a little put off. The more we talked, he had expressed that he enjoyed John Wayne movies. And however it came up, we ended up putting that in his healthcare directive, that he enjoyed John Wayne movies. And we later got a thank you note from his family that not long after he had gone through an advanced care planning visit, he actually did become seriously ill. And his family was told he didn't have much time. And so they played John Wayne movies for him. And they sent a thank you note just saying what it meant to them to, when there was nothing left that could be done for him, they did something that was meaningful. And it just meant a lot. So to think about, what does comfort look like to you? Is there special music? Would you want prayer? What kind of things would be important to you if you knew your time was short? What kind of things would you want the healthcare team and also your loved ones to know about what matters most to you in that situation? I'll talk a little bit more about that, about how putting that actually into writing into an advanced directive. The third thing, exploring goals for medical care. So when we fill out a healthcare directive, and I'm going to touch a lot more on that in a minute, there's no possible way we can cover every single decision that might need to be made when it comes to healthcare decisions. So we like to think about some overall goals for care and what matters to you, but there are a few things that are important and that are covered on healthcare directives. And one of them is this situation. So we're going to just take a second to explore this. So I want you to imagine this scenario. A sudden event, such as a car accident or illness, left you unable to communicate. You are receiving all the care needed to keep you alive. And I'm going to just pause right there. And I know some of you read ahead and you're already knowing the rest of the story, but we're going to stop there. You are receiving all the care needed to keep you alive. And I just want you to think about, what does that look like to you? If something happened, you're in the hospital and you are receiving all the care needed to keep you alive. What does that mean to you? What does that look like? So some people, when I read that, they'll say things like, well, I picture a lot of monitors. I picture bells and whistles. I picture people coming in and out of the room. I picture breathing support. I picture IV pools. And so that's the situation we're talking about, some intensive care kind of setting where things are being done to keep you alive. But then our story goes on to say, the doctors believe there's little chance you will ever recover the ability to know who you are or who you are with. So as you think of that part of the story, what does that mean to you? So when I've read this, when I meet with people, I'll read this scenario, and when we start to before we can process what this means to someone, people start to automatically think about what they want. And I've had people just interrupt me and say things like, pull the plug. They know for certain, if they were in a situation where their loved ones are being told that there's little chance they will recover the ability to know who they are or who they're with, they're very clear they do not want aggressive measures to be continued to keep them alive. Other people, however, when I read this situation, they see the part where it says there's little chance you'll recover, they say, aha, so you're saying there's a chance. So this situation is really individualized to people. So it's important for you to think about, if this were to happen to you, what would be important for you to understand, and what would your goals be in this situation? Would you want to continue medical treatment to keep you alive for as long as possible, no matter what? In other words, is the length of life more important to you, or is quality of life important to you, or that thinking about what a good day looks like, to think about if there was little chance you would get back to doing the things that you enjoy most, would you want to continue those efforts? So this is an important thing to think about. What would your goals be in that situation? As we look at the healthcare directive, this is one of the questions that is covered, and I'm just going to skip ahead, and we're going to cover the directive, but I'm just going to read how it's written on a healthcare directive for just to kind of get your thinking along these lines. It says, if I can no longer make decisions for myself and my healthcare team and agent believe I will not recover my ability to know who I am, I would want. And then it goes on to give choices, but it says, with either choice, I understand I will continue to receive pain and comfort medicines as well as food and liquids by mouth if I'm able to swallow. But then it goes on to ask you to choose, would you want to stop or withhold the treatments that extend your life? And this may include tube feedings, IV fluids, respirator or ventilator, so the breathing machine kind of support, CPR, and antibiotics, or would you want to continue all those treatments? So I just want to introduce the idea of the fact that these directives can be individualized. So somebody might say, I don't want to continue this indefinitely, but I would want to try for a time trial. So, or I would want to try until my daughter can get here to say goodbye, or whatever would be important to you in this situation. So I just want to make it clear that although there's boxes on these forms for you to initial, there is space to make this as individualized to you, and to elaborate on a point and what would be important to you in that situation. And I'm going to come back to that again in a little bit. When we were talking about COVID, and I had mentioned I'm going to refer to Minnesota Honoring Choices. They have excellent resources for patients regardless of what state you live in. So if you're a Wisconsin resident, this is also very relevant. You can go to their website and they have a COVID-19 advanced care planning guide. And this is helpful for you to think about if you were to contract COVID, but also honestly, it's helpful for any kind of serious illness. It goes over things like what would your goals be for hospitalization? You know, some people that have a serious illness have said, you know, I'm ready to be done with aggressive measures, and if I get seriously ill, I just want to be cared for at home. So it gives you time to think about those kinds of things. Oxygen support and mechanical ventilation is covered on there, and so I want to just take a minute to talk a little bit more about that. Since on the healthcare directive, breathing support is not something specifically covered, and I wouldn't be surprised if in the future it is, because of what we've learned through the coronavirus. Because as we know, the breathing support is one of the most biggest decisions a lot of people have been faced with. So have you thought about what your wishes would be if you were having difficulty breathing? So the first thing, if someone's having difficulty breathing, would be the oxygen support just with the nasal cannula, and most people are familiar with that. But if that's not working, a lot of times what might be recommended is what's called a BiPAP machine, which is a little more forceful way to get the air into the lungs, but it's still considered a non-invasive form of breathing support. So it's not that intubation, that tube into the throat. Would that be acceptable to you based on your health condition, under other underlying health conditions, and what would your goals be in that situation? Again, is it to recover from an illness or injury, or if they thought that you're not going to get back to breathing on your own, what would be important for you in that situation to know? If things like the BiPAP or other forms of non-invasive breathing support aren't working, the next thing would be the mechanical ventilation or that breathing tube. So your thoughts on what would be important to understand in that situation. And it's not covered in most healthcare directives. So I do encourage people to really think about their goals for breathing support and to at least include a statement about their thoughts on breathing support in their healthcare directive. And I'll share some sample statements on that as we look at healthcare directives. Another decision that's covered on most healthcare directives is the question about CPR, or cardiopulmonary resuscitation. So before I ask you to check a box on what you want, the first thing I usually like to talk to people is, what is your understanding of CPR? What is it for? When is it used? So just to get us on that same page, again, I'm referring to this Honoring Choices Minnesota website, but they have some patient resources, and the CPR information is one of them. But it talks about how CPR is done and what it is. So most people are familiar that CPR is done if the harder breathing stops, and it's an attempt to get that harder breathing started again. It might be the chest compressions. It might be that breathing support like we just talked about. It might be a shock, or the paddles, as some people say. It might be some IV fluids to correct, or some medicines to correct an imbalance that's going on in the body. It might be, or is likely going to be, all of those things. And so it's important to think about it. Will CPR work for you? And if people have an underlying health issue that they're potentially dying from, obviously it's not going to be as successful on getting that harder breathing going again. So what I like people to think about is, CPR is done to attempt to get the harder breathing going again, but it doesn't correct the underlying cause of what caused that harder breathing to stop. So it might lead to the ICU kind of experience where we were just talking about a little bit ago, where things are now being done to keep you alive. And so it's important that we get the harder breathing going within just a few minutes of when it stopped, to get that good oxygenated blood to the brain and out to the body. And if we're not able to do that, or if it's not done correctly, we might be in that situation that I described where the brain has now been affected, and what would be important to you in that situation. So when we talk about thinking about the CPR, it's important to think of it do you need to have more conversation with your doctor? Do you have underlying health issues that you'd like to explore, to think about, would I want CPR attempted if my heart or breathing stopped? So when we look at this is from the Minnesota Honoring Choices Healthcare Directive, but the Wisconsin Directive is worded very similarly. So it describes what CPR is and then gives you the choices, and you would initial by those choices. So the first one is, I want CPR attempted if my heart or breathing stops, period. I'm going to skip down to the bottom one. I do not want CPR attempted if my heart or breathing stops. I want to allow a natural death. And then it goes on to say, I understand if I choose this option, I should see my healthcare provider about writing a do not resuscitate order. I just want to very briefly talk about that. If you've taken the time to really think about advanced care planning, fill out this directive, and you do all the right things, but you go to, say, you're at Target and something happens to you, people aren't going to know what your choices for healthcare are. They're not going to know what you've chosen for CPR. So they're going to just do their best to help in that situation. So these healthcare directives are when you are in the hospital, when the ambulance has been called and you're already at the hospital and things are being done and the care team is trying to decide, should we keep doing this? Do they want us to start CPR if the heart stops? What's going on here? So the healthcare directive comes into play when something has happened and you're not able to speak for yourself. It just really informs the conversation and informs the medical decisions for the providers. But for some people, where we wouldn't be surprised if they were to have a sudden event and pass away in the next, or just because of a serious illness, pass away in the next 1 to 2 years, they might be appropriate for having some outpatient, some orders that they can carry with them, to have, like if they're in an assisted living facility or they're on hospice and they don't want to be resuscitated, they could have orders from their provider. So that's a little bit different. So I just wanted to clarify that, and feel free to ask me if I've made that more confusing instead of less. But just to clarify what the healthcare directive does, and when it's used. So I want CPR, I do not want CPR. And the middle choice says, I want CPR attempted if my heart or breathing stops based on my current state of health. So how I'm doing today, if something were to happen where my heart or breathing stops, I would want you to attempt CPR. But then it goes on to say, however, in the future, if my health has changed, for example, I have an incurable illness or injury and I'm dying, and I have no reasonable chance of survival if my heart or breathing stops, and I have little long-term chance of long-term survival if my heart or breathing stops, and CPR would cause significant suffering, then I don't want it. So based on how I'm doing today, I want CPR, but if in the future my health has changed, then I wouldn't want it. So I hope that makes sense to everybody. And you can, again, at the end, you can ask me if that was made sense, if you have any other questions. So as we think about all the things that go into advanced care planning, your past experiences, what is important to you for a good day, what quality of life looks like to you, what comfort and spirituality looks like, then taking the time to make those actual decisions about the healthcare, and putting them in writing. So filling out the advanced directive, which is also called a healthcare directive or a living will. Some of you may have already done this in the past, and a lot of local law offices do a great job of covering this when they do estate planning. But the reality is sometimes people don't even know what they checked when they've had that visit, and they may have filled something out and it's in a safety deposit box and they don't even know for sure what it says. So it would be important to revisit, if you've filled out a directive, does it still honor your current wishes? Has there been a change in who you want as a healthcare agent? Are your wishes still reflective of what's important to you today? So even if you filled out a directive in the past, it's very reasonable to fill out another one if there's been any change or if there's just been some time. We encourage you to fill out a directive for the state in which you reside. So if you are a Minnesota resident, we recommend the Honoring Choices Minnesota form. I meet with a lot of North Dakota patients, and as well as our residents from Wisconsin would fill out the Wisconsin. Each state has some different statutes and some different requirements for their residents. So it would be important to choose the document for the state in which you reside. But you live in Wisconsin and you are over in Duluth to get care, your directive would still be honored. There's that, and it goes the other way, but it's important to make sure that we have the directive filled out for the state in which you reside. And these are, as I mentioned, if you're not able to, if you don't have a copy of a directive to fill out, I'd be more than happy to get a copy of that for you. I just want to talk in general about healthcare directives. As you fill them out, everyone I've seen has a space for you to write your name, your information, your date of birth, address, and so on. And then to choose your healthcare agent. So we talked about, who would you want to be your voice if you couldn't speak for yourself? And then really to think of an alternate or two. Some people, it's hard because they say, well, I have 5 kids and how do I pick one? So we talk about who should that first call go to? If you were in the hospital, who should that first call go to? So it's not saying you love one family member more than the other, but maybe who would be the most appropriate person to get that first call and for them to be your primary healthcare agent, who could be your voice? And then the alternate, because sometimes the person we're the closest with might be the person that we are in the same car accident with, so if your primary agent isn't available, who would you want to be an alternate agent? We talked about the qualities of a healthcare agent, but we didn't talk about what we're asking them to do. So on the Minnesota Honoring Choices website, there is an information sheet on a healthcare agent so that you can have that conversation with the person you're asking to be your healthcare agent so they understand what you're asking them to do. Basically, the powers that you're giving them by filling out this legal document is giving them the authority to do any medical related thing you would do for yourself if you could. So it might be to agree to or refuse or cancel decisions about your care. They might decide on what tests or treatments are appropriate or not, or refuse treatments or agree to them. So you're giving them that kind of authority. But there is some space for comments or limits on that, on the directive. But then each of the documents, both the Minnesota and Wisconsin, have some additional powers of the healthcare agent, and they would only be given those powers if you initial by them, such as, do you want this person to also be the one to make decisions about the care of your body after death? Would you want them to continue as your healthcare agent even if your marriage or partnership is legally ended? So to look at those choices depending on the document you're filling out. I just want to mention in the Wisconsin form, there's some additional powers that if you don't have a healthcare directive and you've not given your healthcare agent authority, one of the questions is in regards to admission to a long-term care facility. And some people say, well, I don't want to go to a nursing home, so I'm not going to give my healthcare agent that authority. But the reality is, if we don't have someone named as your decision maker and you've not given them that authority, then it ends up going through a court process where a guardian is then appointed. So what I say is I would rather have someone that knows me and understands me to be the person to help make some of these decisions, as opposed to it having to go through a court process. So that's my 2 cents on filling out that part of the directive. There's some additional resources on the Honoring Choices Minnesota, and one of them is this new tool that I have found incredibly helpful, and it's called Making My Wishes Clear. And I had talked about how you can make these documents as individualized as you want, but we want to make sure that we're not making it more confusing for the healthcare team, that we're making sure things are very clear and they're able to understand them in the heat of the crisis. So this form goes through some sample statements, and you're able to read through and see which of them resonate with you and just kind of give you ideas how to put your thoughts into writing and to put them on the directive. I had talked about that in my opinion, how important it is to write your thoughts on your breathing support, what you would want if you were having difficulty breathing. And this is covered on here. And I just want to just briefly read a couple to see, just to give an example. One statement says, if there is even a small chance I will resume breathing on my own, I want a ventilator or respirator. So if that's what's important to you, some people, want to make it clear that they would accept any kind of treatment to help them recover from an illness or injury, but not if it's not going to get them improve their quality of life. If it's just keeping them alive, they don't want to continue in that way. So these kind of help you think, your thoughts and put them into actual statements that you can write on a healthcare directive to try to make things more clear. And I see we have some questions coming in, so I'll keep going here, and then we'll get to some of these questions as we go. On the healthcare directive, there's the question, as I said, about CPR. There's the question about if you could no longer make decisions for yourself. So talking about that, if there was a severe and permanent brain injury, what would your thoughts be? But then there's space for you to write any other thoughts on treatment choices. So if you have some specific things that you want to make sure is clear to your healthcare team or your loved ones, there's space for you to be able to write your thoughts about any other treatment choices. So again, thinking back to your life experiences and what's important to you. One woman I'd worked with, her husband had Lou Gehrig's disease, and after what she saw him go through, because of that, she was very clear, I do not want to ever have a feeding tube placed. And so because of her life experiences, there were different things that were important to her. So if there's things that you would like to make clear on your document, but as I said, there's no possible way to think of every single decision that would need to be made or choice that might come up. So to think of some overall goals, I've seen people that they've expressed that I want to live as long as possible, regardless of, quality of life. Living is what's important to me, but then to define what does that mean to you? So as we think about that, on the page 6 of 8 on the Minnesota Healthcare Directive, it kind of goes into some things that would be helpful for the healthcare team in guiding some of this conversation if you were seriously ill. One of them is called My Hopes and Wishes. And on the Wisconsin form, it's worded slightly different, but also gives space for you to write about the things that are important to you. The Minnesota form says, the things that make life most worth living to me are, and this is where to think back to when I talked about what does a good day look like? What does living well mean to you? So I've seen people write things about how, being able to interact with their loved ones, their family is the most important thing. What things make life most worth living to you? But then on the flip side, my beliefs about when life would no longer be worth living. And I don't really love how that's worded, but what it's getting at is, at what point would you want to give your family or loved ones that guidance to say, if things were to this point, that is when I would want you to stop the efforts to keep me alive. So I've seen people write things like, if it's decided that I will not regain any brain function, I do not want to continue efforts to keep me alive. So what would that unacceptable outcome be to you? At what point would you want to give your loved ones or the healthcare team that guidance that this is the point that would be, I would want you to stop the efforts to keep me alive? And then, do you have thoughts and feelings about how and where you would like to die? For example, if you knew your time was short, if they were saying we've done all we can and the time is short, would you want to be at home if able? Would you prefer to be like at Solvay Hospice House? Would you prefer to be kept in the hospital? What would be important to you if you knew your time was short, if you were nearing death? And then when we talked about that kind of spiritual support and what comfort looks like to you, there's space to write, what would you want your loved ones to know that you would appreciate about comfort and support? So, would prayer be important? Are there certain songs that are important to you? Are there any rituals or prayers or music, or what kind of things would be important to you if they knew your time was short? And then there's space to write if you have any religious affiliation, for example, if you would want a faith community contacted for a pastoral visit, if possible, those kinds of things. And then any other wishes or instructions. On the document, there's also space to choose if you would want to be an organ donor. So would you want, some people say, well, I don't know what I've got that could be used, but what I say is you don't have to decide that. It's just, do you want to give the healthcare team the authority to make that kind of decision? Or would you prefer not? And then also, would you want to give your healthcare agent the authority to request an autopsy if it can help them understand the cause of death, or not unless it's required by law? So once you've taken time to really think this all through and put those wishes into writing, to make this a legal document, you will need to have a witness signature. So you will need to have, in Minnesota, either a notary or 2 witnesses. And the witnesses cannot be the person you've chosen to be your healthcare agent or someone that's related to you by blood or marriage, but just 2 people that adults that are willing to say that, yes, on this day I saw this person sign their document. They don't have to review it. They don't have to know what your goals for CPR are or anything like that. They just have to say that, yes, of their own free will, this person signed their document. So in Minnesota, it can be a notary or the 2 witnesses. In Wisconsin, it's not a notary, it's just 2 witnesses. So just pay very close attention to the state where you reside, what their requirements for the legal authority for the signature is to make it a legal document. So the next steps, as we were talking today, based on if you have any underlying health issues that you want to talk to your healthcare team about before you fill out the directive, I encourage that conversation with your healthcare agent as you complete this. And then as you get those wishes into writing, as I talked about, getting that witness signature to make it a legal document is incredibly important. But then you want to give copies to your healthcare agent and then to wherever you receive care. So if it's here at Essentia or if you have a specialist somewhere else, wherever you receive care, you're going to want to make sure that a copy is on file so we know what your wishes are so we can honor them. And then you'll want to talk to the rest of your family and close friends and tell them who your healthcare agent is and what your wishes are if you feel that that's appropriate for your situation. I like to say that the reason we started advanced care planning here at Essentia is because, it's the right thing to do and because, we want to honor patients' wishes. But the reality is what drove advanced care planning was the amount of ethics consults we were getting because one family member and another family member were really at odds with each other. One person saying, we should do this, and another saying, Mom would never want that, and families being tore apart by these decisions. And we know that's just not the best way to take care of people. So if you're able to have these conversations proactively to share your wishes so that people can come alongside of each other and support each other during some of the hardest times, it's just really a gift to everybody that you have around you if you're able to share that with them ahead of time. And again, it doesn't mean you love one family member more than the other. We need to have a healthcare agent and an alternate listed, but you can choose to include other family and close friends on there, and you can write that on your directive if you want other people involved. But we really encourage you not to have, we don't want to make decisions by committee. We can choose to who to inform, but it really needs to come down to just, a primary decision maker is important. And then keep a copy where it can easily be found. What I say to that is if you're a snowbird, if you're going to be doing some extended traveling or things, it's important to just bring a copy of you in case something were to happen. If you receive your care here at Essentia, as I said, there's a few ways to get your advanced directive into your chart. If you have the My Charts app, you can upload it through your My Chart account. You can email it to us at hisadvanceddirective@essentiahealth.org. You can fax it to us. You can mail it to us. If you have an in-person clinic appointment, you can bring the document in and ask it to be scanned into your chart. Some people have difficulty making copies at home. So if you don't have the ability to make copies, our clinics have been excellent about helping people get those copies made. So you can share them with your loved ones, and then you would keep your original documents. And then to review it periodically. Advanced care planning is a process, not a one-time event, as I said. So as you go through life, as your circumstances change, you may change your mind, and that's okay, and that's good. We encourage that ongoing conversation. So when you go in and have an exam and they ask, do you have a healthcare directive? You can say, yes, I do. But does it still reflect your current wishes is what's so important. And so that periodic review, it goes through the life changes. So every new decade of your life, but really maybe even every 5 years to say, does this still reflect my current wishes? If you experience the loss of someone close to you, maybe they were your healthcare agent or maybe you've changed your mind based on what you've seen them go through. To revisit your healthcare directive, changes in relationships. Do you still want the person you named as an agent to be your agent if you're no longer in a relationship? If you get a new diagnosis or a decline in your health. For really any of those major life changes, to be revisiting your directive and make sure it still reflects your current wishes. Just to give you those resources I've been referring to, again, Honoring Choices Minnesota, if you click on their tools and resources, the ones I particularly like are the healthcare agent, CPR, help with breathing, and my favorite is the Making My Wishes Clear in the pink there, I think is extremely helpful. So if anybody wanted to look at the questions that have come in, I'm happy to answer any other questions. Otherwise, I do have my my contact information here. If you wanted to reach out at any point, I'm more than happy to answer any other questions. And thank you so much for your time today.
Wanda, there are a few questions that came in through chat.
Okay.
What Rachel asks, how does a power of attorney play into all of this?
That's a great question that I'm glad you asked, because some people have a power of attorney that might be a financial power of attorney, and that is not the same thing as a healthcare power of attorney. So some people previously had what was called a living will, and then they also had a power of attorney designated. So it would just be important to designate if it's the healthcare power of attorney, and if someone has that document, that would be what we call the healthcare agent now. Sometimes if somebody has lost capacity to make decisions, if somebody, has Alzheimer's disease, or they have had a traumatic brain injury, they might have to have that healthcare agent activated, where now we say that that person is now their power of attorney. So I hope that makes sense. But just to understand that there's a difference between the financial power of attorney that someone might name in their, like when they've done their estate planning, that can be a different person than who you choose for your healthcare decisions.
Great. There's another question. If my healthcare directive is on file at Essentia, what happens if I'm seen at St. Luke's or some other hospital?
Mm-hmm. We've had this come up a lot lately, and we do try to, if someone has a directive, if when you're admitted, if you're able to say, yes, I have one, it's on file at Essentia or whatever, we're able to get those records back and forth. If you're able to have a copy when you go somewhere, it's good to bring it with you if you are going somewhere where you don't normally receive care, so that there's not any delay with that. But we do have something called Care Everywhere, which is a way to kind of share those medical records between different facilities. So we do have that ability to Mayo Clinic, different places. We do have a way to be able to get those documents quickly if needed.
Okay. And Sandy, hi Sandy, is asking, is CPR necessary to keep you alive if you are an organ donor?
That's a very good question, and that is something that on the Wisconsin form, I think that's even one of the things that comes up, that sometimes life support might be something that is done, to keep for the time period of, deciding if someone has decided to be an organ donor, then those kind of efforts might be continued until that time. So that is, if you've chosen to be an organ donor, on the Wisconsin form, I'm just trying to flip through it. There is a way to register ahead of time to say that you are an organ donor, and basically to give that permission to continue those efforts for that reason. So there's a website, donatelife.net, to make your preferences legal that way. So that's a very, very good question as well.
So there is no other questions in the chat. Does anyone have any questions? You can take yourself off of mute and feel free to ask.
I'm thinking, I'm Terry. So I've got mine out and it's a 2008. And so then I should just go in and download and print it. I mean, it's old.
Yeah, and to be honest, I have been screening every hospital admission for people that are high risk, that there's something serious going on, and it's striking how many really old documents we have, and finding, that now we're scrambling. Does this really reflect someone's current wishes? Is this what they still want? So I selfishly would really appreciate if you would do that.
Well, but it doesn't have some of the options you talked about. I mean, they've changed the form in the.
Yeah, so if you had some verbiage on your old document and you'd want to write some of that on a new document, you can bring some of that over to make sure that the new document very clearly outlines what's important to you.
I mean, it doesn't address CPR. It doesn't address, it doesn't address any of the issues that you talked about, which I think are super. So I'm looking at, so can I go to Honoring Minnesota and
yeah, yep. The Honoring Choices Minnesota, yep. And this, it's an 8-page document, and I feel like it's robust enough that it covers a lot of all this information, but it's not too overwhelming. I feel like it's pretty user friendly. So yeah, Honoring Choices Minnesota, and you can download that. It's also on our Essentia Health website under Advanced Care Planning. We have all these resources on the site as well.
And one more question. My husband is an Arizona resident and I'm a Minnesota resident. And so they have an Honoring Health or Honoring Choices in Arizona. So then we each just fill out.
That would be perfect.
This was a really good seminar, by the way. Thank you.
I'm glad to hear it. Absolutely.
Wanda, another question came through chat. If an ambulance is called, are they obligated to do CPR?
Yeah, great question. So that's when we talked about CPR, that for people that when an ambulance is called, they are going to do CPR unless they have those out of hospital resuscitation orders. So the POLST order, it's called. So for at Essentia, our policy is that if we have a patient that we feel we would not be surprised if they were to pass away in the next 1 to 2 years of life, to have that conversation. If someone has chosen that they do not want to be resuscitated, they can have those out of hospital resuscitation orders. So then it's a medical order that's portable. And if an ambulance is called and someone has said, I do not want CPR, the ambulance crew would then have the orders not to do CPR if that's their choice. But otherwise, yeah, they would do CPR, and that does cause some conflict. Sometimes there's a family member saying they're a DNR, but the reality is the ambulance crew, they can't sort it all out right then. They just have to act. So unless they have that medical order, they're going to just do their best in the moment. So the advanced directive comes into play when someone gets to the hospital then, and do we continue these efforts or not?
Any other questions from anyone? All right, I'll take silence as a no more questions. Wanda, thank you very, very much.
Absolutely.
This was very informative, and I think you certainly have helped everyone realize that these are issues that need to be talked about. And it really doesn't matter how old you are, because like you said, anything can happen on any given day. So
yeah,
I
absolutely.
appreciate the information, and thank you for the work that you do with people to help them understand how important this is.
Yeah, I can't thank everybody enough for joining me today for this, because it is such an important topic. So thank you so much, everybody.
Thank you, everyone. If you're interested in participating in future webinars, or if you have questions, you can contact us at Miller-Dwan Foundation. If you have ACP specific questions, please take Wanda's contact information and reach out to her. Otherwise, feel free to visit the Miller-Dwan Foundation website to see what's on the calendar or to support any of our projects. So everyone have a great evening, and thank you for being with us.